Hi, everybody. Thank you for joining us for our November PD EDU. We are very excited to welcome Diana and Valerie from Right at Home. Our wonderful program committee member, Mary, recommended that we invite them to present today. So Valerie, Diana, if you guys want to take it away, floor is yours.
Right. Good morning, everyone. I'm Valerie. This is Diana. I am the Director of Operations for Right at Home Home Care in Cincinnati and Northern Kentucky. And we're just here today to kind of talk about what we do and how we can help you age in place and remain in your home. Right at Home provides in-home care services to individuals who are struggling with Parkinson's disease, along with a lot of different ailments. We provide comprehensive support with the vital activities of daily living that is required in order to continue living a more full and happy life despite the limitations and difficulties of serious disease. When you are determining if you need an in-home care agency and which one to use, there are some things you need to consider. So Right at Home is a franchise. We provide non-medical home care. We are in pretty much every state in the United States and 7 other countries. Excuse me. One thing you should know if you're looking to do home care in the state of Ohio is it is a non-licensure state, which means anybody can start a home care company without no oversight. You could literally get out of prison today and start a home care company in Ohio tomorrow, and there's no one to oversee that, which to us is very scary because you're inviting pretty much strangers into your home to provide services. So one thing that sets Right at Home apart from the rest of the companies is we are Joint Commission accredited. What that is they are the accrediting body that oversee hospitals, rehabs, nursing homes. We chose to go through that 6 years ago. So we are held accountable just like a hospital is. They come in and do annual surveys on us. If there's ever a complaint survey, knock on wood, we've never had one, they will come in and do a survey within 48 hours to see what's going on. So a lot of the hospitals and rehabs and nursing homes do refer to us because they trust us as a legitimate, big, take it serious company. Another thing is I am a registered nurse. I now have 3 other nursing staff members. They're all LPNs. Even though we're non-medical, we still have nursing oversight. We feel that that is important in the community because Parkinson's, Alzheimer's, a lot of our clients are very sick. And yes, caregivers can provide care, but who's going to oversee that care that can really look at the clinical side of things, talk to doctors, talk to nurses. So that is why we have nursing on staff. If you're determining whether you need in-home care, you should see is the individual or yourself with Parkinson's struggling to complete your ADLs or unable to complete them without assistance. Your ADLs are your activities of daily living, your showering, your toileting, your dressing, meal preparations, medication reminders. Those are all things that we can help you or your loved one do so you can stay at home and age in place. What positive impacts can an in-home care agency provide to an individual with Parkinson's? Well, we all know that Parkinson's clients benefit from a regular routine. It is very important to have a regular routine. You make sure you're taking your meds on time. You're doing exercises daily. Our caregivers can help with that regular routine. We can come in the morning, help you get up, get ready for your day. We also like to do restorative therapy with our clients. So exercises on a low level, walking, arm, leg exercises, we can help with that and make sure that you're continuing to move forward. We kind of believe if you don't use it, you lose it. So we're big believers in keeping people moving. We teach our caregivers to do with our clients, not do for our clients. Doing with our clients means we include you. If you're able to get your shirt on, we're going to have you get your shirt on. We may help you with your pants and your socks and shoes, but anything you can do, we're going to encourage and help you do it on your own to keep you as individual as possible. We can also support family caregivers. We know a lot of our clients, their main caregiver is their spouse or their siblings or their children. We also know that they can get burned out because they're not caregivers, they're family members. We want our family members to be able to be family members and to have that time with you to spend doing family things, not caring for your loved ones. So that's where we could come in to provide the care so you can maintain the family aspect of it. You know, experienced and qualified in-home care agencies. You know, when you're doing research, I always tell people when they call me, you want to ask questions of how do they get their caregivers? You know, we are very serious about what we do. We're sending strangers into strangers' homes. So we want to make sure that we have legit, caring, compassionate caregivers. So we do phone interviews first. If they pass that, they come in for an in-person interview. Once they pass the in-person interview, we have to have 2 positive references. And then we actually make them go down to the DMV and be fingerprinted for a BCI FBI background check. That is very important to us because if they're in trouble in California and have rerouted to Ohio, we want to make sure that they have a clean background so that they do not start working for us until we get that background check back from the state saying that they are clear. A lot of companies do not do that. The cost of that is about $50 per caregiver, and there's always a revolving door of caregivers. It is the nature of our business. So a lot of companies do not do that background check, and we feel that that's important. The second important thing is drug testing. We have always drug tested. I've been with this company for 7 years, and about 3 years ago when the drugs got really bad in the area, we went from a 5-panel to a 10-panel drug test. So we are drug testing upon hire, and then we are doing random drug testing every month. We believe that is very important too, because once again, you want honest people in your home. A lot of companies are not doing the drug testing right now because of the cost of the drug test. And some of them are on the fence with the way the marijuana laws are going. You know, what are they going to do about that? That has been a big talk in our community, but we are still continuing drug testing, and we don't care if you have a medical marijuana card or not. You're not going to work for us if you can't pass a drug test. You also, excuse me, as you slowly begin to lose independence, that's when we can come in. Some of our clients start very small with us. You're still fairly independent, so you may only need us for 4 hours in the morning to get you going, and you don't need us the rest of the day. That's fine. We are very flexible when it comes to care. Once you start getting your resting tremors, your bradykinesia, rigidity, all those types of symptoms, and you need more care, that's when we can come in and start doing more care for you. Once again, we will keep you as individual and independent as possible. We all know that, you know, having your house set up is very important to make sure that you have clear pathways, that your living area doesn't have cords, rugs. I know a lot of people love to have rugs all over their houses. That is one of the worst things you can have in your house, because your walker does get hung up on rugs, and the biggest thing is falls. Falls to us are, you know, what we want to prevent. We train our caregivers on a fall prevention program that we make sure that they're walking with the clients when you're up and moving. We're getting those cords and those rugs and wires out of the way. Lighting is very important. People don't think about that. They like to have their curtains closed, maybe not have the lights on. Lighting is very important when it comes to being in your home so you can see where you're going.
Yeah, I turned our.
Go ahead. Regular exercise is important, especially for someone with Parkinson's, so we can keep moving in the right direction. I know the Parkinson's Foundation and the Blue Ash Parkinson's, they all have exercise programs. We really feel that if you're not getting exercise, you should be doing it, if not daily, at least 3 times a week. You want to avoid foods and high cholesterol and saturated fats. Those are not good for you. Canned fruits and vegetables are horrible. We always promote fresh veggies, fresh fruits. Our caregivers can run to the store for you and buy all of your groceries for you, bring them back, put them in your fridge, and also prepare meals for you. We want to make sure you're getting enough sleep and staying hydrated. And those are all things our caregivers can help do. We know people don't like to drink water, so a reminder every hour, hey, let's take some sips of water, you know. Those are all important things. So with us being in your home, we like to say you can age in place, you can be safe. You know, we can take care of you, drive you around. What questions, does anybody in the group have any questions about in-home care, or have you had in-home care and had bad experiences, good experiences? See, someone's connecting to audio.
All new to us.
All new to you? Okay.
Mhm.
All right.
I've got a question.
Yes.
Can you care for more than one person at a residence?
We can. So when we get the call to come out and start care, one of the nurses will come out and do an in-home visit that's free. We do a complete head-to-toe nursing assessment. If there is more than one person in the home, we will do nursing assessments. If it's a couple, if it's siblings, we can do more than one nursing assessment, and then we set the care accordingly. We have couples care, and our pricing is based on the need of the client. So if one client really only needs meal prep and light housekeeping and laundry, well, the spouse or the sibling that's living with them needs full care, we adjust the price. Our caregivers, we are not like most companies. If we're in seeing Mr. Smith, but Mr. Smith is living with Mrs. Smith, we will prepare meals for both of them. That is not an added charge. We will do both their laundries, we will do the housekeeping, all of that. The only time that the charge goes up is the amount of care that we provide to each individual, but we can definitely take care of more than one person in the home.
Great, thank you.
Has anybody else experienced in-home care or have it now besides, I know Mary? Mary, we want to tell us about your experience with in-home care?
My experience with in-home care has been great. I've appreciated at home, around the house, helping me get the right person. It's been fantastic. And she's very reliable and she's very kind and she lets me independent, and yet she helps me when I need help.
Yes. Is it okay to share with them that I know you? So I know Mary very closely. We've known each other, I think 4 or 5 years now, Mary. Has it been that long?
It's not that long, it's only 2.
Seems like it's been a while, but you know, Mary is pretty independent in her home. We just come in and help when she needs it. And that's what we base our care on, is the need of the client. There are a lot of companies out there that will do contracts. You must use them for 40 hours a week or 20 hours a week. That's not how we operate. Ours is based on the need of the client. So it's what you need is when we're there. If that's 1 day a week, great. If that's 7 days a week, we can accommodate that too.
Mine,
Are there a minimum amount of hours that you come? I'm asking.
So the minimum amount is 4 hours right now. Before COVID, we were doing 3-hour minimums. COVID kind of put a damper on our caregiver supply, so we've had to up it to a 4-hour minimum per shift. But I have a lot of clients that only use us twice a week during their days that they want to shower. And then while we're there, we're changing their bed linens, doing their laundry, maybe preparing a few meals they can heat up later in the week. So, you know, we're very flexible.
I have a question. What geographical areas do you reach?
Okay, so we do Claremont, Butler, Warren, and Hamilton counties in Ohio, and then we are in northern Kentucky, Boone, Kenton, and Campbell County in northern Kentucky.
Thank you.
Maureen, did you want to say something?
I just wanted to say, and so I'm a nurse practitioner in case you didn't know it, you see. In my experience with the people who have home care, I think it's the match that's so important, you know, and some people, you really have to develop an attitude, the person receiving the care, that first of all, it may not be exactly how you would do things, you know, but they're there to help. And so it's a give and take relationship, I think.
I agree. So when we do our nursing assessment, one of the pages on the assessment is to get to know the client, you know, where they were born, what they did for a living, you know, what kind of activities do they like to do? Do you like to go for walks? Do you like to sit on your porch? We ask those same questions of our caregivers when they're hired, and our computer program is really good, because when we put that in about the client, this is what the client wants, these are the activities. We also put that in with the caregiver. And then we put the care plan in of what is the acuity level of our client. We make our caregivers go through a skill checkoff, so their acuity level of what they can handle. So our program matches them up. Once we do the match, we start calling caregivers, tell them about the new client. That to us is one of the key components of good care, is having that match. So we really try to match them up. Now I'm going to say it's not 100% all the time. I've had complaints where someone talks too loud, someone talks too softly, someone talks too much. So when we start a case, we do introduce the caregiver. We stay around for the first 15, 20 minutes, kind of see how things go, and then we leave, let the caregiver take over. At the end of the first shift, we call the client. How did it go? Did you like your caregiver? Was there anything that you didn't care for? We always introduce 2 caregivers per case, so there's a backup and you have a choice. Now, if you don't like either one, we keep introducing until you find the one that you like. But anytime a new caregiver comes out, one of my clinical liaisons or community liaisons is out to do that in-person introduction. So we're not just sending a stranger to the house. We think that that's key to make sure that everything starts off smooth. And feedback from our clients and our clients' families are key. We do not use an on-call service. I have caregivers who work from home that do our on-call after hours. So if there's ever any issues, concerns, complaints, even positive things, you can call someone and get a live person at any time. So if someone does fall, they call on call to report it. Hey, there's been a fall. On call in turns calls one of the nurses. At that point, we call the caregiver, find out what happened. We may go right out and do a supervisory visit to see how they're doing. We may tell them to call 911. But once again, having nursing on staff gives us the opportunity to go out and do a nursing assessment, maybe call the doctor, let them know what's going on. Whole point of that is so you're not ending up at the hospital. We believe if you go to the hospital, you get sicker. So we really try to keep our clients from going out. Maureen, one of the things we do is track change of condition. So even the caregivers are prompted at clock out. Did you notice a change in your client? If there is any change off of that care plan that's in the home, it'll prompt them. Was it walking? Was it skin? Was it, bowels? Once that change of condition comes through, it notifies the nurses, whoever's on call that day. We follow through that. We may call you, Maureen, and say, hey, one of your clients has gained 3 pounds, or ankles are big, we need to get something going. We want to have the interdisciplinary team where we're all communicating, clients, families, doctors, nurses, all of us, so we can keep you home safe and out of the hospital.
It's
I had a
great.
question. If we could go back to the the coverage question, since you appear not to touch in Montgomery County, do you make references to
We do.
agencies?
So I'm not from Cincinnati. Where's Montgomery County?
Centerville, Dayton?
Okay, so we have a right at home office up in Dayton. And they do cover that area. So if someone calls here that's not in our county, we do our best to find the office that can cover it.
Okay.
And if I don't have an office that covers it, I will refer to a competitor. We refer back and forth because even though we're competitors, it's still, the goal is to help the population age in place. So if I can't handle a case or I can't staff it, I will call one of my competitors to ask if they can.
Thanks.
What other questions do you have about in-home care?
I'm Carol. Do you have a OT on staff? Is one of
An
your?
occupational therapist?
Mhm.
We do not. We work with a lot of skilled and private therapy companies. So if we're in a home and we see someone that may need PT or OT, we make the proper referrals to either a skilled company or someone like Angela that runs her own PT company.
Okay, thank you.
Yes. Does anybody else have any questions about home care?
With a scheduled caregiver, can that caregiver be a nurse, or is it caregivers and then you bring in nursing help?
So, right, we just have caregivers, but we have a wide range of caregivers. So you have STNAs, which are state tested nursing assistants. They have been through schooling, they have state tested, and they are certified to be an STNA. We have CNAs, which are certified nursing students, but they have not tested yet. Then we have home health aides and companionship aides. So depending on the need of the client would depend on which type of caregiver you get. If you're fairly independent. Low acuity, you're going to get more of a home health aide CNA. If you need a lot of care and you're advanced in your disease process, we're going to send an STNA in because they have been to school and they have been trained for the higher acuity clients. With me having nursing on staff at any time, though, I can send a nurse out to a home to do a visit, to do a reassessment. Some of my clients, my nurses fill Medisets for, so we're seeing them weekly going out and filling their Medisets. So my nurses can do some skilled care. It's just very limited right now. I just started hiring and building my nurse team up in the last 3 months.
Great, thank you.
Yes. Anybody have any other questions about home care?
Okay,
One of the biggest things, oh, go ahead, Robert.
Let me get right down to it. So here's the situation. My father has Parkinson's and some dementia, and it's pretty far along. My mother's in a skilled nursing facility right now, getting over, she had an operation that now she has a colostomy bag. She's probably got about 30 more days in the skilled nursing facility, and then she'll be returning home. We have a family member staying with my father right now who at some point in time has to go home to his family. So I'm going to have that situation, and I cannot have my mother be in charge. She was the caregiver for my father before getting sick. So now I can't have her put her own health at risk by having to do anything for my father. So what type, in a state, trying to keep them in home, in their house, what kind of staffing would you think of something like that, if possible?
So with your mother, when she comes out of rehab, they will set her up with what they call skilled home care nursing, which is a nurse, PT, and OT. And they will manage that ostomy bag for a matter of weeks until she gets home and gets in a routine. We do this a lot with clients where one is the caregiver for the other, and the one that's the caregiver gets sick. That's where we come in and we do couples care. We could help your mom with her ostomy bag and her rehab and getting better, and we could help your dad with his activities, daily living, and depending on where he is with his dementia, you know, redirection, cueing, things like that. Our two biggest diseases right now that are in our population for my clients is Alzheimer's, dementia, and Parkinson's. We have seen, I've been with the company 7 years, and in the last 3 years, I have seen a huge uptick in the amount of clients that we care for with Parkinson's and Alzheimer's. And I am a certified dementia trainer, and I've also been very involved with Parkinson's over the years, and I like to feel like I do know a lot about it by doing research and extra classes and CEUs. So, Robert, that's something that if you want to give me a call afterwards or on Monday or something that I could talk to you one-on-one, that'd be something we could definitely help you out with.
That would be great. Thank you.
I will tell you, your medical insurance does not cover our services. We have been fighting for the last 5 years to get Medicare, Medicaid, Humana, Aetna, all of that to pay for our services. And we were actually really making traction until COVID hit. Once COVID hit, all those talks got shut down because obviously all their attention went to COVID and vaccinations and testing and all that. Our hope is that they pick it back up at the first of the year. We were told that we were going to start getting reimbursed this year. It hasn't quite happened, but we are hopeful that we can get this part of the continuum of care and your insurance will pay for us. With that being said, we do take workers' comp. We do take long-term care insurance. So if you have long-term care insurance you've been paying into, they usually will cover our services after an exclusionary period. And then other than that, it's private pay. Our rates go from anywhere from $28 to $35 an hour, and that's based on the nursing assessment and the acuity of the client. If you are more independent and you just need standby assist and a little bit hands-on, you're going to come in on that low end of the spectrum. We have clients that are quadriplegics and paraplegics and everything. They come in on that higher end of the spectrum because of the amount of care that is needed for them to stay in their home. One of the other things that we like to mention is I do have a Parkinson's client right now whose family lives in North Carolina, and she does and is still able to go visit when she's feeling good. And what happens with that is we call our North Carolina office, let her know that this particular client is coming down there for the days that she'll be, and we will hand off the case to that office for the time she is out of town. And then when she comes back, we take her back over. I have a lot of clients that leave Cincinnati for the winter because it's too cold. They may go to Florida or Arizona. I have offices in both of those states too that can handle it. So if you like to travel or you're still able to, most likely we'll have a home care company in the area you're traveling to, and we can set you up with care. So maybe you can go attend a wedding, or go see family members over the holidays. That's something that we work very closely with our other franchises to make sure there's that continuum of care. Any other questions for us? Well, Julia, I know I'm supposed to talk for an hour, but I don't have much more information than what I've already said. I don't need to go over Parkinson's. Everybody understands Parkinson's and the challenges. I just wanted to make sure everybody was aware that, what we do is we keep people in their homes safely, and we make sure that they age in place. We're firm believers. In my background before I came to Right at Home was I ran a facility, and I literally watched people give up their belongings, move into a facility, eat when they are told to eat, do activities when they are told. And I watched them give up on life, and it just got so depressing for me. That's why I made the switch to in-home care, because I am a firm believer that if you stay in your home and are able to age in place around your belongings that you've collected and your pets and everything, that you will thrive so much better than moving. And that is our whole goal, is to keep you home safely and age in place.
Mhm.
Definitely.
Yeah.
So Nancy is actually our administrative manager at the office. And Nancy, do we have any materials for Right at Home? I was going to check this week, but due to my cold, I wasn't able to.
Oh, no, we don't. So if you could send me some materials, that would be wonderful.
We could drop some off to the office. I can have Diana run over this, coming week, and we'll drop off. We have flyers, we have price points. We'll drop a bunch of stuff off to you.
Okay, we get calls. This is very, Julia, we were texting about how interesting this is. I have actually 2 personal friends with Parkinson, and they really are in need of this service, because the spouse works a lot of times. If the spouse is gone for a period of time, it's very difficult, and the spouse still needs to work or wants to work. So very helpful information.
Right. And, and if they go to the hospital, we can get them home from the hospital. If they have rehab, we can get them to rehab and bring them back if it's outpatient. Our caregivers are all bonded and insured. They have to have valid driver's license. We have a whole credentialing list that we have one person in our office that literally just does credentialing day in and day out to make sure we have everything we need for our caregivers. Part of our business is developmentally disabled. So we also handle Down syndrome, autism, things like that, and that's through the state. So our credentialing is pretty intense for a private duty home care company. It sets us apart from a lot of the other companies around town.
That's good to know. Very good to know.
The other thing you'll hear is the biggest complaint you'll hear if you talk to somebody that's had home care is probably my caregiver didn't show up. Because when I started in this business, that was the biggest complaint I heard. I have come up with plans, I guess you would say, as if a caregiver doesn't show up. If a company tells you it doesn't happen, they're lying. It does happen. Caregivers call off. They will do a no call, no show. Yep. Unfortunately, it's the nature of our business. But how do you handle it when it happens? So we have taken our top caregivers and made them salary caregivers, and they're called care managers. And what they do is they'll do training. They may do the skills check off for the new caregivers in my office, in my skills room. They'll go out and do supervisory visits for me. They'll do training of other caregivers. They'll do introductions. But what's really good is if a caregiver does call off at 8 in the morning because their kid's sick and can't be to work by 9, I can reroute a care manager, say, hey, I need you to stop what you're doing and run over to Miss Smith's house because we have a gap in care and we need to make sure that she has coverage. So I have backups. If my care managers are all busy, myself or my nurses will go out and work shifts, because our whole business model is caring for people who need it. And if you're not there, then they're not getting the care. So we have backups in place to make sure that there is coverage on all of our clients.
Your contact information will be in the material that's being sent out to everyone that's in attendance today by email.
I'll get it to Nancy this week and we'll send it and make sure you guys get the information you need.
And so that will then allow me to understand how to track down this service through Dayton and that area.
You can call me directly if you want to. My cell phone number, if you have a pen, I can give you my cell phone number.
Sure.
It is 513-262-2193. And you can call me anytime and I can tell you who you need to call up in Dayton. I can route you to the correct person and give you the number you need.
Okay, and I'm embarrassed to say I didn't get your name.
Valerie France, Frantz.
Okay, thank you.
Yep.
Well, thank you, Valerie and Diana, for being here today. We really appreciate it. Does anyone else have any questions while we have these lovely people on the phone with us?
I do have one quick question. Do you
Yes, Robert?
Is it possible to get 24-hour care?
There is, yep. We have a lot of cases that are 24/7, and we just go out and provide care around the clock. Sometimes we'll start as a 24/7, like in an instance with you where your mom is coming home from rehab, needs to get back into a routine. Once we get our clients into a routine, our caregivers will report to us if they start sleeping through the night. Our whole goal is to help the clients, not to make you spend all your money on home care. So if we can get a routine in place and get them going to bed at 10 and getting them up at 7 in the morning, and so they're sleeping through the night, then we can cut those nighttime hours out and save you some money. And our caregivers are very good at reporting, hey, they're now sleeping through the night and they don't need us here. Why am I here? We pride ourselves on, we do what we need to do for our client, and we don't try to overcharge. We don't try to add hours on. This to us is, we want you to age in place safely, remain in your home for as long as possible. And it's their goal and it's our goal. And so if we can weed those 12-hour nights out and save some money so they can stay in their home longer, then that's what we're going to do.
Mm-hmm.
Mary, I think I saw, oh, sorry, Robert.
That's okay. I'm done.
Okay, thank you, Robert. Mary, I think I saw you raised your hand. Did you have a question?
I was going to say that everything that they've said, can you hear me?
Yeah.
Yes.
Everything that they said is absolutely true. I use them. My husband works full-time still. I use them 3 or 4 hours a day, 5 days a week when he's working. And there's times when I need help because I'm in a wheelchair. And when I need help getting to a doctor's appointment, and when I need help get in and out of the bathroom and bathtub, and that person is always really responsible and cheerful about doing it all.
Mary's had her caregiver for as long as Mary's been with us, and I think they have a great relationship. And your caregiver has been promoted, and she's still going to stay with you no matter what.
Right, right.
So I hope everyone has a wonderful holiday season. And again, thank you, Valerie and Diana, for being here with us.
Thank you.
No,
And if
thank
you guys
you.
have any questions, call my cell phone. I'm accessible 24/7.
Okay.
Thank you.
Thanks.
Thank you so
you.
much.